Good day once again. Welcome back to Sculpting the Family Through Nursing Care. We're into segment 2 of episode 1. And this episode, we speak about family focused healthcare in our developing country, how we feel about it. We just had segment 1 where we spoke with Ms. Jamil Kong, the Assistant Director of Yours Truly Clinihealth, a nursing services company established in Jamaica during COVID-19. We just spoke about why Yours Truly Clinihealth, why choose Yours Truly Clinihealth. We spoke about their management system. We spoke about their nurses being trained in CPR, that's cardiopulmonary resuscitation or basic life support, and many other things. So this segment is about the match. How is it that YTCH matches their nurse to the patient or the nurse to the client? So the patient is a person in need, the person who's actually sick or has a need. The client is the one who asks for that particular care. How is that match done? What's the process they go through to do it? What are their checks and balances? And who's the person that does that match? Ms. Kong will do a summary for us and tell us how it's done and introduce for us Ms. Jones, their team coordinator, in a short moment. So Ms. Kong, the floor is open. How do you do that match?
Thank you. All right, so when it does come with making a match for the nurse, we really do match them not only to the client, but to the family as well. Because I said, the backbone is important as it relates to getting better and focusing on your health. So it all starts with first contact, right? We try to get to know the client, what the ailments are, what the issues are, as well as the do's, the don'ts, the personality. Try to get a feel of them as a person, not just the sickness, not just the health issues, right? As well as the family. Who is it that they're looking for example? Is there a particular age group? Are you looking for someone with even a particular amount of experience? What type of personality traits are you looking for? Because we do know the nurses, we know certain personality traits that they may have, right? The bubbly personalities, for example, or do they want someone who is a bit more stern? Do they want someone who is able to run around to kind of, interact with active clients, or do they want someone who is able to work on their feet for long, or to sit down, be able to read little stories, bedtime stories, or communicate with mom or dad, whoever it may be, in a particular way? We try to pinpoint and just pick out certain things that we know that will basically match the nurse well, right? Personality traits, as I say, characteristics, years of experience, age, how flexible they are, because it really is dependent on what the family needs. Right, we try
Right,
to pinpoint what it is that they're looking for, who it is
right,
that they're looking for, who they're picturing in the home, because at the
right.
end of the day, we're entering their personal space.
Yes.
So they have to be comfortable with who we're sending out into their home, who they're going to have, their children or their other family members, maybe the adults, whoever it is that they're caring for, who they're going to have coming in and interacting and engaging and just being in their personal bubble. A personal space is a very peculiar place to be, right?
Personal bubble, you said. So
Yes,
in other words, you're saying that YTCH, that is yours truly Clinihealth, is dynamic. Is dynamic. You roll with the flow and you provide the people what they want. You know, the
right.
politicians will say, give the people what they want. But you do that. You do that with a basic understanding as well that your nurses are properly trained. So
Yes,
they have the healthcare and medical training that is necessary to
most
fit the
definitely.
family as well. And that's one of the most important things as well, and that they're certified. So, having said that, Miss Kong, tell us a little bit about your team leader who is actually responsible for making this match before we actually speak with her. Tell us about her a bit. So we're not
Most
talking about
definitely.
your team. So that's you, the scientist, the masters in science and animal biology. And we have the RN that supervises everything, the registered nurse. We have your manager. Now we have your team coordinator. So we're going to talk with your team coordinator today, the person who does the match, because the
Right.
match has to be perfect, right? It's like a wedding
Have to.
ceremony. Wedding ceremony? Maybe not, right? But anyway, let's talk about her. Let's tell me about her a little bit.
No problem. So, with who you're going to meet in a few, her name is Miss Kadian Jones. Now,
Mm-hmm.
Nurse Jones has been a member of the team basically from the get go. She's an emergency medical technician and has been for the past 10 or so years. She's also a phlebotomist. So, she does have an in depth understanding of how health works in Jamaica, of certain family dynamics, of
Mm-hmm.
knowing how to react, of course, in an
Mm-hmm.
emergency, right? She knows the ins and outs of any health issue you can think of, right?
Mm-hmm.
And we are happy to have her on the team for her insight again, solid backbone, right?
Mm-hmm.
And of course, Miss Jones is who pays attention to matching the nurse to the family and
Your
how we
family.
can build on that family dynamic and who will go into the home.
So she's a ticket to the dream of the frustrated mother. I keep
Most
mentioning the
definitely.
mothers in them because the mothers are the nurturers. It's that estrogen in us. I use the word us. It's that estrogen. It's
Oh,
that
yes.
estrogen. The mothers are the frustrated ones, the nurturers, really. We have to go to work, we have to work, and we have to take care of the family as well. So we
Yes.
tend to organize quite a bit. Our men are the lions. They are filled with the testosterone. So they have to hunt, right? And so they have their job and their, but we'll talk about them later as well. And how we actually sculpt the family through
Yes.
nursing care because sometimes the lions go down and they need
Mm.
help. So they'll need a good nurse. I think there's a song, I don't remember the name of the singer. Night nurse. I mean, there are lots of connotations to it, but the point
Yes.
is, the point is, people need good nurses
Most
and
definitely.
nurses who are well trained, who will carry out their duties well, and will give the proper outcome that we desire so our families can be whole and wealthy. And we need that in our Caribbean country. Recently, I heard some statistics that mentioned that the birth rate in Jamaica is falling because this year women are so
Yes.
stressed out working. Men are stressed as well. Don't have time to raise the family. You need a little help. Nobody to take care of the child, and so on. And adding a trained healthcare professional to that dynamic within the home can
Yes.
make the world of a difference, knowing that your child does not go hungry when you go to work. So, Miss Jones is on now. Welcome, Miss Jones, Miss Kong. Thank you so much.
Thank
Miss
you.
Kadian Jones, the team coordinator for the match, matching the nurses of yours truly, Clinihealth, to the families. Miss Jones, welcome. Tell me a little bit about yourself. Please tell the
Hi,
viewers. Hi,
hi, hello. How are you?
I'm fine, thanks.
About myself. What can I say about myself? Miss Kong said it all. I don't think there's anything else to say.
There's always something.
Um, I should. What can I say about myself? I'm very orderly.
Okay, you're orderly.
Yeah, very orderly.
What else?
Compassionate,
Mm-hmm.
somewhat strict sometimes,
Mm-hmm.
and I'm a go-getter.
You're a go-getter. Okay,
Yes.
good. And we need that kind of personality
Yes.
when it comes to getting the job done. That's important, getting the job done. What is it that you look at when you're matching the right nurse to the family? What's the rubric that you use? Share with us. Maybe you can give an example of a family without, try to maintain, the anonymity of that family, of course. But tell us a little bit about your experience in the Jamaican setting. We in Jamaica, we're in the Caribbean, it's a warm island. Persons have needs, have wants, have fears. And as West Indians, we tend to keep a lot of things to ourselves, and we have these fears and we keep it inside and we don't talk about it. And the mother would say, or the father, I don't really like that one, but I don't know how to say it. I just have to do what I have to do. And so a lot of women, they say, boy, I'm just band the belly, do what me have to do till me can get rid of that one day. And so they get rid of the person who is there taking care of the child. They really want somebody else. And so a lot of our people in homes, they go through this trauma. And through yours truly, Clinihealth, I recognize that because you do that match, or women and the families do not have to go through that trauma of having a bad match with someone who comes into their home and wrecks the home. You don't want our home wreckers, right?
No, we
Right?
don't want any home
Good.
wreckers.
We want professionals within the home that will take care of this. So how would you match? Let's talk about kids. We just spoke about the nanny care service that YTH provides, but your nannies are nurses. They are licensed practical nurses, yes?
Yes.
That's the training. Good. And tell me a little bit about the licensed practical nurse, if you do know. I mean, what is it that they do? How are they trained? How do you do that match? How many months of training do they go through? And then understanding that then allows you to match them with the right family and the needs.
All right. Regarding the licensed practical nurses, we employ already licensed practical nurses. It's not like we train them. They come to us trained as licensed practical nurses. Some do 1-year courses, some do they just practical nurses, some specialize in geriatric, and some do pediatric. And pediatric takes, I think, an additional 3 months. So that's how that part is done. However, when they come to us, before we send them out to the family, we normally have our little sessions where we go over what we call refresher course then. We give them little scenarios, we give them little incidents, just show it out at them to see how they would react, and then we will tell them how they should react to it. But when it comes to matching them with the family comes first. So what we do, we have a conversation with the family. As you said, we're dealing with nanny for the time being. We have a conversation with the mommy, we have a conversation with the daddy if the daddy is available. But you do know that the queen runs the kingdom, not the king. They think they do, but they don't. So we talk to the mommy. The mommy will tell us, oh, well, this is what baby is like. And it all depends on the age of the child. You have to think about that. So say, for instance, we're dealing with a 6 months. I'm talking about the 6 months because we have this experience before. So we're dealing with a 6-month-old. And we ask, what's the personality of the 6-month-old? And they say, oh, the baby cries a lot. The baby does not take the bottle. Mostly breast, but mommy has to go home this evening, right? So what does the baby eat? So there and then now we'll pick a nurse that we know is very patient. We have the patient nurse that will, even though the baby is crying, they won't get frustrated. And you have to look at the point that some family members don't allow the kids to watch television, or they don't allow them to interact with tablets and so forth. So it all comes back to the family. So after talking to the family member, talking to the mommy, talking to the daddy, that is how we basically make decision on which nurse to send. Because each nurse has their own personality, just like the baby and just like the family member. So we decide we want a patient nurse, we want a compassionate nurse, and I would rather a nurse that has dealt with babies before or even have children of their own.
Right. But interestingly, in healthcare, we'll say that nurses are compassionate and patient. So in your case, you want a more patient nurse and a more compassionate nurse because you're dealing with that child who is just 6 months. So it requires a different level of patience, experience, and exposure.
Caring.
Right. And love, really. Lots of love, right? I imagine that your team work with love. Through love, a lot of things come out. And kindness. Once someone is has love within them and can express love for others and show kindness, it makes a world of a difference, in care and that's what's important. So my question to you is, how are you the one that monitors the nurses when they're on the job? Do you do it on a daily basis, or is it another member of the team in conjunction with you? How do you do it?
All right, so with our company, it's a team effort, but I am always a go-to person. I'm always the first contact. So I do most of the monitoring. So when they're going out, I'm the first person they speak to. I'm the one who matches them. So I give them a rundown. Oh, this is the client. This is what the client requires. This is what you're going to go there and do. And contact when they get there after introduction and so forth. Then the daily routines begin. I call them, check in, what is happening, give me an update, as so on. And then at the end of the day, I do get a feedback from both nurse and the client.
Okay, at the end of the day. So each day you do that kind of check-in. So you have your
Every
hands
day.
full. So you have your hands full.
Yes,
So that's
and
what
plus I have the
makes
progress notes.
you have progress. Okay, so you all
Yes,
document
we have
as
progress
well.
notes. Yes, document.
So this is where we talk about the medical legal aspect to what you do. So I noticed Miss Kong has left us. Miss Kong has to run off because she has a mission today. So thank you, Miss Kong. That was the assistant director of yours truly, Clinihealth. She's just gone off now. And we have Miss Jones with us. So we'll continue with Miss Jones today. So you have a medical legal aspect, so you make sure that you practice in an ethical manner. Whatever it is you do, you document the things that do happen and you maintain confidentiality. Am I correct in saying so? Utmost
yes,
confidentiality.
you are correct.
Correct. And that's important,
Right.
Many times when you live in an island, they say we're a small place or space and everybody knows everybody's business, but everybody doesn't really want it to be so. Persons rather to have a private life, right? And I say this with utmost respect for your company that you actually adhere to this kind of privacy and ensure that whatever information you glean or receive from the nurses and the family stays within that particular unit and it does not go. So what you go there and see there, you leave there, correct? That was a mantra I heard from.
Right. And that is emphasized.
Right.
We emphasize that.
Emphasize that what you go there and see there, you leave there, right? That is it. The other question I'll ask about is a very sensitive topic, actually, because in present day, we're having a lot of cases of children that have problems in the spectrum, such as autism. And I gather that YTCH has had the experience in your nurses having to care for children who do have this challenge. Let's use the word challenge. So, and oftentimes these children are quite brilliant. They do quite well. It's just trying to understand them. And how is it that you match your nurse in such a situation? How is it that you check in? And give a few examples of the tough times you've had with your team and how you've dealt with that. Because there are a lot of parents that have children that give a little trouble. They call it a little trouble because they're not knowing what's happening. And they don't even have the diagnosis just yet. And they need help. They need help. And sometimes when your healthcare provider goes in, they say, hey, something's going on with this kid, let me tell mommy, maybe they should get this checked out. And there's nothing wrong with it. It's just a support that they need. So tell me, how is it that your team deals with that child or that family with that child who is on the spectrum or has autism?
All right, my question to you, is it that the child has been diagnosed?
Maybe, maybe not. Let's talk about the child that is diagnosed. Let's begin there. You deal with that case.
All right. If the child is diagnosed, what first thing we do, as you had said, patient caring, but extra patient and extra caring, that's the nurse that will send in. First thing, we'll have a conversation with the mommy. We find out how far on the spectrum that baby is or that child is. And we figure out our do's and don'ts. We need to know the triggers, what triggers the child. the likes and the dislikes, and majority of those children has a routine. They already have a routine that they have to adhere to, just in case something might happen. So, for instance, you have a 9 o'clock where they would be watching a specific TV show, or they have to be doing a piano lesson or something like that. So, we have to get the schedule from the parents. That is very, very important, because getting autistic child thrown off is a task. And I can tell you it's a task. Based on experience, I can say we had one before. We have dealt with many, but there is a specific one. Is musically in tune. Extraordinary child, very, very extraordinary. And is very, very sensitive when it comes to noise, even talking. So you have to whisper, and you have to wait on him to pay attention to you visually, directly paying attention to you before you can approach him or speak to him.
It's
And you have to
interesting you
speak
said
with
that. It's interesting. You're the coordinator. You were not the one who went in to deal with this child, yet you know the case so well. That's extraordinary. That's
Yes, I
good.
do, because I do check in, and I have
That's
a
good.
good relationship with all parents.
Okay, good. So that shows that what you say you do at YTCH, you actually do. Because you're telling me about a case, and it sounds as if you were right there. And
Right.
not on spot, but you liaised with the nurse, you liaised with, to make sure everything is nice and smooth. I'm sure that family probably loved you quite a bit. And we have a lot of these cases now where a lot of people who need help. And so the thing is, persons need to call. They can call YTCH.
And
They
let
can
that
take
cut
the
in for
contact
a
information
while.
as well. Pardon?
I'm not, Miss, there is this autism concert that takes place at the Euro Circle. It happens every year. We do participate in that also. So we do get a feel of every little thing, and we try to expose our nurses, because you don't want to have them go in and it's unusual, or they, because some persons aren't really used to certain things, or they haven't seen certain things before, especially the young nurses. So we do try to give them some exposure, so they have an idea of what is happening and how to react, because as I say, every child is different.
So when you go to this concert, your nurses attend the concert with a child, or they just attend the concert? What is this concert about?
It's strictly autism, where the autistic children perform. As I said, they're absolutely brilliant. So you have
Okay.
majority of them dance, some plays instrument. So the nurses go, we participate in it as the medical personnel there. So they get a feel of the entire thing. We have seen instance where, I won't call it a tantrum, but what should I say now? Um, Children get overexcited, and they can't control the emotions, and they do see how they react in public with the parents, and how the parents calm them down. We do allow them to ask questions, because the family members are extremely receptive, and they try to ensure that everybody knows what is happening, and they can interact and just get a feel, so if you end up in that situation, what do you do. So it's an artistic concert. It's basically like an awareness thing, but we
So
participate in it every year.
that's good. That's excellent. And one of the things that is definitely required in our populace in Jamaica and in our Caribbean nations is patience, and an understanding that there are different persons in the world, different people, there are different children. And when children behave in a particular manner, it's not necessarily that the child has no sense or the child is dumb. It's just that the child learns differently. And if exposed, that child can flourish. And so you've mentioned
Right.
the child that is musically inclined, and these children are quite creative. So this kind of awareness is very, very important, because it will then allow growth and development of our nation. And so each child can learn, each child must learn, and there's a space for everyone in our nation. And each person can create a space where they can contribute to nation building, even through the arts. because life is not just about what doing math and English and becoming a lawyer or a doctor or Indian or chief. We like entertainment as well. We like music. Music quells the soul and softens the heart and soothes the spirit, doesn't it? And so you have those children that you're dealing with that have that skill, and that's great. That's wonderful. All right. It was wonderful speaking with you, Miss Jones.
Lovely
We
being
spoke
here.
today about the care that YTCH gives, the nanny care that YTCH offers in the home to our children and mothers and fathers. And this is in keeping with family focused healthcare in our developing country. Because once we keep the family together and the family is healthy, your health is your wealth, the family will be wealthy. And that's important for sustenance and for growth. And so, in our next set of episodes, we will look at sculpting the family through nursing care, because now we've spoken about the child, we now have to move on to talk about the adult that becomes unwell, that gets sick, and the elderly. And elderly persons in the home, that's the grandmas and the grandpas or the great grandmas and the great grandpas, they have a need too. They're here. And persons may believe that persons are old and should just die. And unfortunately, and I'll say this in dialect because I've heard it among persons, money only just for dead. You know, these people have a role to contribute to the family and to society. They have years of wisdom from what they've seen. Once you have an elderly person in your home who is able to think and function, just to be there to guide that young generation, that child, it's a different kind of home you're going to have. That child will not just learn from mommy, daddy, and society and their peers. They will learn the history, the oral history from grandma and grandpa. And this is extremely important. The greatest and wealthiest of families had their grandparents and great grandparents with them for a very long time. And if we were to take a look at a country just north of us, north and east, northeast, that's in Europe, when we look at the monarchy, Queen Elizabeth lived until she was what? Close to 100 or 100? I forgot the number now. But, and so did the king. So the children had their grandparents with them to help in the nurturing process. What about us? What about us in the Caribbean? What about us in Jamaica? What about us in the developing countries with all the challenges that we have? So through nursing care and sculpting the family through nursing care in a very simple way, just providing someone with some food to eat will keep them alive, and the right kind of food. So you'll have your grandparents around for a longer time. So we'll talk about that in our next episode with YTCH, of course, and others. And we'll talk a little bit more about sculpting the family through nursing care. Until next time.